The RCN, the nursing union, is talking about expanding its strike action from A&E, intensive care and cancer wards. They could also join strikes too. Do you support them expanding their action?
Well, first of all, the RCN and the nurses have never taken industrial action ever before, so I think that context is really important. And the leader of the RCN has made it clear that the government have just absolutely point-blank refused to negotiate with them. And I think that we're in this situation because the government are acting in a hostile way towards these workers that kept us going through the pandemic, and they really urgently need to get round the table. No nurse wants to take industrial action and cause, disruption to the care that they provide. But of course, we've seen record numbers of vacancies in nursing care, and therefore their jobs are becoming increasingly difficult because of staff shortages and because of the conditions in which those nurses are trying to do their job. So without this intervention, without the government getting round the table, these issues are ongoing regardless of the strike, because we can't carry on as things are.
Are you concerned about patient safety, though, if nurses were to expand their strike action to A&E, intensive care and cancer wards? And what would your message be to someone whose care could be affected by these strikes?
Well, we've seen increases in waiting times for people, cancer patients and others who are on waiting lists that have increased under the Conservative government. And without this intervention and without the government getting round the table and dealing with the concerns that these nurses are facing every single day, unfortunately, we have a situation where patients' lives are at risk because of the crisis in our NHS. And therefore, they have to get round the table and deal with these issues. They know what the issues are, the government do. They know there's a crisis in our recruitment and retention of NHS staff and nurses, and therefore it's completely unacceptable that they're not willing to speak to the nurses and get round the table. The nurses do not want to take industrial action. It's the first time they've ever taken industrial action in their history, and therefore that tells you the difficulties that they're under, the immense pressure that those nurses are under. And I think most of the public can recognise that, and can recognise that the government are refusing to negotiate and deal with the crisis that they've inflicted upon our NHS staff.
Wes Streeting, the Shadow Health Secretary, says the NHS is not a shrine. Do you agree?
Well, it isn't, but it's incredibly important to the British people. You know, the Labour Party founded the NHS, and the principles of the NHS, free at the point of use, is really important. And people have come to treasure the fact, and they understand the importance of having that situation where when you are in crisis, when you have a medical emergency, you can get the care and your loved one can get the care that they need. Unfortunately, what we're seeing at the moment is people can't access ambulances because of the pressure they're under. They can't get appointments to see their GP. They can't get appointments for cancer treatment at the earliest opportunity because of the situation and the crisis that we've seen in the NHS. And some of that is down to the situation that nurses and our NHS staff are facing. We've got a recruitment and retention and a workforce problem, and that consultants, specialists will tell you that that is a real issue for NHS staff, which is adding further pressure. So unless the government are willing to get round the table and have a strategy for the workforce, as Labour has, then we're not going to see a resolution to this. And the industrial action is part of an accumulation of that crisis of the NHS staff saying, please help us do our job. We want to protect people. We want to look after them. But they're not able to do that at the moment because of this government.
1 week on from the earthquakes that have struck Syria and Turkey, real concern about aid getting into Syria at the moment. The US has talked about easing some sanctions on Syria to help the passage of aid. Would you back the UK taking a similar line?
We need to work with the UN and make sure that we're able to open up those corridors to get that support to the Syrian people. It's absolutely devastating to see what's happened in Turkey and Syria and the thousands of lives that have been lost. And every hour that goes by where those corridors are not open, people are dying and people are not getting the support they need. So I absolutely back us working with the UN to ensure that those corridors of aid can get there and we can support people in what is a humanitarian and tragic crisis that we're seeing unfolding in that area, and we need to get onto that ASAP so that people can get the support they need.
Well, yes, and support so badly needed. The government dropped its international aid budget from 0.7% of GDP to 0.5% in the aftermath of the pandemic. Will Labour commit to putting it back up to 0.7%?
We have committed to increasing the overseas aid budget, and it's really important that that work that we do internationally is not only about how we deliver aid, but it's also about our soft power internationally in terms of working with our allies and developing our values across the globe. So it is really crucial and very short-sighted of the government to cut that aid budget, and we think that it should be reinstated. But, you know, the situation that we face at the moment in Syria is so dire that the UN need to get together as quickly as possible and to make sure those corridors of aid gets there. And I want to also pay tribute to those people in the UK, our emergency services, our rescue services that are over in the region at the moment that are supporting those efforts, and to continue to coordinate those efforts internationally.
The Defence Secretary is saying today that the UK is going to conduct a review into its own security after a fourth object has been shot out of the skies over North America. How concerned are you about Chinese spy balloons?
Well, I think national security has got to be absolute paramount to us, and I welcome that the Defence Secretary has said that they're going to review it in light of what's happening. You know, we have to work with our international allies, and the US were absolutely right to take the action they took, as well as Canada, and we have to remain vigilant, you know, and ensure that our military services and our security services have the support they need to deliver, and we have to play an international role in that and remain vigilant. So yes, we should be constantly reviewing our security and ensuring that our security services have the support they need and the resources to do their job effectively.
And I know today Labour is talking a lot about waste on government procurement cards, government credit cards, if you like. Tell us what the figures are, because I was speaking to the Government Minister, Richard Holden, earlier on, and he said, according to his figures, spending has come down on the cards since Labour was in power. He said 995 million was spent on the cards in 2009, and last year it was around 150 million. So can you clear up what you're saying today?
Sure, Richard is confusing. What happened in 2009 was the procurement cards were used by other public sector organisations, local government, the NHS and the BBC. We're talking about Whitehall use of credit cards, and that is extremely increased under this government. And there was a National Audit Office report and a Public Accounts report years ago that was very clear to the Conservative government that the use of these cards needs to be transparent, that they need to be regulated and that they shouldn't be excessive. And yet we've seen thousands of pounds spent on art. We've seen thousands of pounds on a hot pink photo booth for a showing of a film. These are not what I would consider a cost of living crisis appropriate use of that spend. Of course we need credit cards for emergencies, but their use should be transparent and they should be appropriate.
You're pledging to bring in an office of value for money to sort it out. Isn't that going to be expensive in itself and introduce more red tape and bureaucracy?
No, because we're pulling together a number of organisations at the moment, a number of areas where that can be used to set up the Office for Value for Money, so it will be cost neutral. But not only that, the work that they will carry out will save money in making sure that the government is acting in a lean way. We've seen scandal and we've seen sleaze. We've seen billions of pounds wasted under the Conservative government that we have now, and no action to clear up this mess. We've been very clear that we would set up an Ethics and Integrity Commission that's independent, that can look into these issues and can ensure it's regulated. And our Office for Value for Money will ensure that every pound of taxpayers' money is spent, they're getting the best out of that money and that it's not being wasted. And these credit cards are a way of bypassing the normal auditing process. And we're seeing, you know, when it comes to the end of the financial year, big jumps in the spend. And we're seeing expenditure which is just not justifiable during the cost of living crisis. So there has to be transparency and there has to be regulation of the use of these cards.